Hi everyone, my name is Jeffrey Callahan, and today my presentation will be on the differences and similarities seen between the Costa Rican and United States healthcare systems. To first understand these systems, one must understand the underlying population demographics that allow the systems to function. So in the United States, there are around 335 million people with an annual growth rate of 0.33%. And in contrast, Costa Rica has a population of about 5.15 million with a 0.9% annual growth rate. The elderly population in the United States is 16.85% of the total population, and in contrast, in Costa Rica, it's 8.76%, which is about half of what's seen in the United States. The unemployment rate is 7.3% in the United States currently, whereas the unemployment rate in Costa Rica is 17.08%. Both of these unemployment rates are higher than normal due to the fact that there were a lot of civilians laid off during the pandemic in each country. The population below the poverty line is 15.1% in the United States and 21% in Costa Rica, which is also affected by the pandemic related layoffs. Ethnic groups in the United States include white, black, Asian, American Indian, Alaskan Native, Native Hawaiian, and other Pacific Islanders, as well as others. And the languages include English, Spanish, Chinese, and other. Ethnic groups seen in Costa Rica include white, mulatto, indigenous, black, and other. And the languages spoken in Costa Rica include Spanish, which is the official language, as well as English. The healthcare systems in these two countries differ drastically. In the United States, it's a mostly private healthcare system with public options that cover about 91.5% of the entire population of the United States. Private coverage covers about 67%, whereas public coverage covers about 33%. And there are 8.5% of the population that is uninsured. The annual GDP spent on the percentage of annual GDP spent on healthcare in the United States is 17.1%, and out-of-pocket spending per capita comes out to about $1,112. Additionally, the WHO ranks countries each year to show what their healthcare coverage looks like in terms of the rest of the world. The United States has a ranking of 37. In contrast, in Costa Rica, there's a universal healthcare system that offers the option to have supplemental buy-in private options. The percentage of GDP spent on healthcare is 9.1%, and out-of-pocket spending comes out to about $910 per capita. And they are ranked slightly above the United States in terms of the World Health Organization's healthcare rankings at 36th. In terms of expanding coverage, the United States has the option to either provide more private or public insurance, but it would mostly rely on private insurance at this point. Whereas in Costa Rica, almost entirely it would be from the government in terms of expanding care for citizens. Healthcare statistics that are important in these countries include the physicians per 1,000 citizens, the acute beds per 1,000 citizens, the wait times for non-emergency surgery, and the population where cost is an issue to receive healthcare coverage. So in the United States, there are about 2.6 physicians per 1,000 people, and it's slightly above that in Costa Rica at 2.89 per 1,000. This is mostly due to the fact that there is a much larger population in the United States. So on average, there are close to 3 physicians per 1,000 citizens in each country, which is interesting given that Costa Rica normally imports their physicians that receive training in other countries. The acute beds per 1,000 citizens in the United States is 2.44 and is drastically lower in Costa Rica at 1.1, which can become an issue especially in times of crisis, like during the COVID-19 pandemic, when ICU beds are critical to receive care in those in critical condition. Wait times for emergency surgery differ drastically between the two countries. In the United States, it's an average of 24 days of waiting versus 520 days of waiting in Costa Rica. This is mostly due to the fact that it's a universal healthcare system in Costa Rica, which means that any citizen can receive care as long as it's covered by the government-funded insurance plan, meaning that non-emergency surgeries are delayed drastically, and usually Costa Rican citizens seek this care in private insurance covered facilities. Uh, and both countries see a similar population where cost is an issue for care at 33 and 30% respectively in the United States and Costa Rica. The United States and Costa Rica also both see similar breakdowns of citizens who are satisfied or dissatisfied with the current state of healthcare. In the United States, those who are very or fairly satisfied are 30%, whereas in Costa Rica, that number is 23%. Those who are unsure of where they fall in the spectrum in the United States are 25%, whereas in Costa Rica, it's 27%. And then those that are not at all satisfied are 43% in the United States and exactly 50% in Costa Rica. However, in the poll that was conducted, these 50% that are dissatisfied in Costa Rica also are no longer willing to pay into the CCS public system if that were an option on the table. So this is something that Costa Rican officials are having to deal with at the moment. Some of the key healthcare outcomes in the United States versus Costa Rica are life expectancy, which are similar for both countries at 80.43% in the United States and 79.41 years in Costa Rica. The birth rate is similar, but is higher in Costa Rica at 14.53% as compared to 12.33% in the United States. And in the United States versus Costa Rica, the death rate is slightly higher in the United States and slightly lower in Costa Rica at 8.35 and 4.86 respectively. These numbers are typically similarly seen in developing versus developed countries, with a higher birth rate and lower death rate in developing middle income countries like Costa Rica versus established developed countries like the United States. The maternal mortality per 100,000 births is 19 in the United States and 27 in Costa Rica, respectively. And the infant mortality per 1,000 births is 5.22 in the United States versus 8.59 in Costa Rica. These numbers are also seen similarly throughout the world in developed versus developing countries. Some of the top mortality causes in the United States and Costa Rica that are shared include cancer, heart disease, accidents, stroke, lower respiratory diseases, diabetes, and then differing in these two countries are COVID-19 as a top cause in the United States, influenza and pneumonia in the United States, Alzheimer's disease, as well as nephritis. And in Costa Rica, some of the differences seen are COPD, cirrhosis, and interpersonal violence. These are the references that were used throughout the presentation, and I hope that you have learned something about the similarities and differences seen between the two healthcare systems in the United States and Costa Rica. Thank you.